All right, we'll go ahead and get started. Good afternoon, everybody. Time out.
Sorry, Mike.
Too much feedback. Is this any better?
Can you pick up the headset?
How about now? All right, we're good. So thank you, everybody, for joining. We got a combination of all kinds of different groups, field, and some admin folks. The main purpose for today is to give some reminders on situational awareness, different things that you're going to come, that's going to come up during your shift, as well as outside of your shift, really. This session is going to be recorded, kind of a test drive, so we can take advantage of the technology and hopefully expand on this and do some monthly topics, as well as bring some safety stuff to the entire organization. So with that being said, we'll go ahead and get started. The topic today is situational awareness, like I said. So when people call 911, they do not expect mediocrity. They do not expect people to show up at their door with hats turned around backwards, people that haven't shaved, shirt tails untucked. They expect professionals. They expect experts. Whether you are or are not an expert, in the field of medicine, they still expect some level of professionalism. Christopher teaches in NEOP that most lawsuits start with somebody being rude to somebody else. So just be the expert, be nice. That's all you got to do. It's not that hard. Another thing that we preach is perfect practice makes perfect. So if you do it the right way and you do it the right way every time, it's going to become a habit to you. It's just like shooting free throws. Larry Bird used to shoot 100 free throws at a time, and perfect practice makes perfect. Another reminder, when people call 911, it's not up to you to judge what their emergency is. They have deemed whatever they're calling is an emergency. It's not up to us to judge them for what they've called. Just be nice. It's that simple. You have no idea what's going on in their personal life, what's going on in their situation that prompted the call. But all you got to do is just be nice. All right? So the thing about situational awareness, knowing what's going on around you, as well as know what's going to happen before it does. Things that come to mind is, what's going to keep you from going home at the end of the day? Because that's the goal. When you show up to work, your goal is just going home at the end of the day. So there's all kinds of things that are out there that are put our folks at risk, put all of our team members and everybody at risk. There's violence against responders. There's psychiatric folks, MVCs, code 100s. They're all on the rise. I tend to, when I was in the field, you could judge a lot by people's eyes. And I always made eye contact because it's something about those people having psychotic episodes, you could tell in their eyes. And so making eye contact with people is really important. And driving, we've had a rash of code 100s, a rash of MVCs this month, all really due to complacency. Probably a majority, well, not probably, a majority of these incidents are from rubbing wheels on curbs, striking road hazards, things like that, from just being complacent and not maintaining situational awareness. So the whole goal on this is a reminder, to pay attention, know what you're doing, know what your surroundings are at all times. And so as you're out there running calls, the things that come to mind, when you show up on scene, you do your primary assessment, see what's going on. What are the life threats? What do I need to fix right now? There's three things that if you do not correct immediately will result in death. That old saying that all bleeding stops eventually. Well, it does. Control a hemorrhage, airway. Somebody's got an airway compromise, put an airway adjunct in there, do something to fix that airway. If you don't, start CPR. So those three things right there are the main things on, controlling the life threats that you identify in your primary assessment. You got all these things going through your mind. You know, the average human body holds about 5 liters of blood. Irreversible shock starts at about 2.5 liters. Thing about irreversible shock, once you go into it, it's the point of no return. Your organs start shutting down, everything starts shutting down. It's ultimately going to lead to death. It's something that cannot be corrected. You've done everything you can, but they're not coming back from that. On everything you do, the most important aspect is knowing what you don't know. I don't care who you are, how long you've worked in the field. There's no such thing as an expert at judging blood loss. You know, you can't look at blood on the floor and say, oh, that's a liter. Yeah. Because as soon as you get to an emergency room, start saying, oh, it's about a liter of blood. And then all the questions are going to start happening. Okay. Well, has it thickened? What was the depth? What was the diameter? So what you don't know, you don't know. It's really important because, you know, once you know that, then everything else gets simplified as you're practicing your trade and maintaining awareness on everything that you're doing. So question, when does your situational awareness start? Well, it never ends really, but as you're sitting at post, as you're sitting at the hospital, as you're driving, as you're responding to calls, it never stops. You're assigned to calls, it continues. You know, you maintain awareness, you know, like the fail-safe standards that Mike teaches in the NEOP, that should be carrying on with you. Your eyes should be forward. You're constantly looking in all directions. Your partner is not glued to their cell phone or mobile device. They're scanning traffic as well. And one thing that we're really seeing in some of these vehicle incidents is that eye movement pattern of not looking far in advance. You know, people tend to look that 3 to 6 second range right in front of them, but what really catches up with them is what they don't see 10 and 15 seconds ahead. So the situational awareness does not stop. Traffic, we see it at all times. You know, you're looking in this situation, somebody might be looking far ahead. What's going on? Oh, what a beautiful skyline. Oh gosh, you know, I wish I was up there rather than back here. And then bang, lo and behold. Maintain situational awareness. Never stop looking while you're inside of an ambulance. Don't get distracted by cell phones, mobile devices, or anything else that you're doing. It doesn't stop once you pull on scene. Once you pull on the street, you know, what's going on? Are all the street lights out? Are there other vehicles stopped? There are other responders there? Is anybody running outside of the house? You know, what's going on? It's not the time where you start, you know, adjusting your shirt tail, putting on your PPE or anything. Have your eyes up. Always be looking around. Situational awareness while parking. This is a big thing. There's an art of parking in an ambulance on a scene. There's an art of parking an ambulance anywhere, which we'll get into. But, you know, when you park an ambulance on scene, you want to park to where that back of the ambulance has direct ingress into the front door if possible. You don't want hills, you don't want curbs or anything else. You want to try to find the flattest surface that's available. One of the things that we're going to touch on in the safety committee meeting is maneuvering the stretcher. That when I was in the field, I saw it a lot, that people would raise that stretcher height all the way to the top. Well, that's load position. It's not movement position. That stretcher should be parallel with the ground as you're moving it around. That way it avoids the tips and everything else. But the point of this is looking for a flat surface, something that's flat, that's not going to cause, you know, you to lose, you know, the balance of the stretcher or anything else that you're moving. Look for a flat surface. Parking. So we got 3 options to choose from when we get on scene, get at post. I don't know. I probably worked in the field for 15 years, and the goal at post for some is to find shade. Doesn't matter if it's at a business or anything like that, but just to find shade. Some other people, it's to make themselves invisible. It's your preference, but the goal of being a post is being available for the system. Having good egress from wherever you're at, good place to park. So you got 3 options to choose from here on parking. You got like a dirt parking lot, gravel, or concrete. So what are we going to choose? All right, look at all the rain we've had. Don't want dirt. Look at all the gravel. No matter how much gravel is there, we are going to sink. I know there's like around Wonder Drive in 820, as well as down in Burleson under those underpasses. Those are gravel lots. And these ambulances are still going to sink in wet gravel, and they're still going to get stuck. And an ambulance should never be taken off a flat top, off concrete. You know, if it is, there better be a great reason why it is, and it better be a dry surface that you're going on, because these trucks will sink. They do that, you know, there's potential for damage there. Another thing that we were talking about was parking, you know, with good access to get out of the business. All right, so you got two potential options here, both right across the street from one another. You got a pretty busy convenience store, but by gosh, I really like their burritos there, so we're going to go there. Or you got the 7-Eleven right across the street that's got a wide open parking lot. Can't really see from the picture, but as we pull in, you know, there's potentially 2 or 3 ways in or out. Which one are we going to choose? Now, too much traffic across the street at the Great Burrito Store. Well, let's just go to the 7-Eleven. I'll get a taquito or something else. You know, like I said, the goal at Post is to make yourself available, mitigate any kind of delays that you're going to have getting in or getting out. You know, find some place that it's got ease of access. You can get in or out. There's multiple ways in the event there's traffic in one direction. But these are things that you need to be looking at. Just like when you pull on scene, at any place that you're going, you should identify 3 ways that you're getting off that street, out of that apartment complex, or off that scene. Another thing that we preach is keep your head on a swivel. That's why we talk about that eye pattern all the time while driving, and always be scanning, always be looking around. You never know what's going to come up from behind you, from the left, from the right, or anywhere. Keep your head on a swivel. If this, you know, there's all kinds of threats that are out there that we talked about. But if you look out for you and your partner, you're going to be able to catch some of these hazards and some of these threats. So you always want to be look around. Don't walk with your head down. Don't be too focused in your mobile device. You know, have your eyes up, pay attention, know what's going on. Then when we get on scene, we have to determine, is this safe or not safe? You know, in this situation, car's on fire, nah, it's probably not safe. You know, you start pulling up into a scene, you see people running from the house, is this safe or not safe? And then why are we here? All right. We're here to provide care. We're not here to judge people for what they called 911 for. We're here to provide them a great service. Sick people look sick. And it's one of those situational awareness things. You walk into a house, somebody's pale, cool, diaphoretic. More than likely, they're probably sick and something's going on. That's when you start diving into what exactly is going on in the situation. So we got people from all kinds of different backgrounds in the organization in all kinds of different career fields. You know, we got volunteer firefighters, we got paid firefighters that work with us. And one thing to remember is just leave the specialties to the specialists. Right? We don't have extrication equipment. We don't have the safety protection in order to do that. Leave that stuff to the professionals, to the paid departments that are responding, that have the equipment, have the training, and have the tools in order to do that job. And now we start getting into some scene assessment things. Success of a scene is dependent upon the actions and reactions of the first arriving unit. It's in any kind of situation that we run. It can be a single unit response. It could be a multi-unit response. You know, you get on scene, you assess the scene, you make contact with everybody that's there, with all the other agencies that might be there. You start working through a plan, developing unified command, and make things happen. Establishing command. The first thing we get on scene, once we've done that assessment outside to make sure everything's safe, is establish some form of command, right? It's when we find the officer or find anybody from the local fire department that's responding, the local first response agency, police department, or anybody. Establish command. Make contact with them. Don't big league them. Don't walk right by the guy holding the clipboard. Don't disrespect those people. Make eye contact with them. Hey, I'm my paramedic. What's going on? Oh, well, we got this, that, and the other. Show them some respect. Follow the process of establishing command. On these big incidents, we tend to focus too much on laying hands on people. That we really rely on that primary paramedic, how our scene is developed, and how we've got supervisors that aren't readily accessible. Within that 2-minute window, we rely on our advanced providers and even our basics to really establish command. They're that incident commander as far as the medical aspect goes of that scene. So somebody on that unit has to have their hand in a pocket and the other hand on the radio, communicating, let people know what's going on, assessing the scene, figuring out what their needs are, what their objectives are, and moving on. The last thing you want to do is start touching people because now you're handcuffed. All right. Well, what really needs to be done is having some form of command established, gauge the scene, figure out what's going on, and start requesting resources. Well, I thought incident command was only established on these critical scenes, these multi-unit responses. No, not necessarily. If an ambulance shows up at my house, and it's just an ambulance, they need to make contact with that incident commander. If my wife is there, she's the incident commander of my house. I'm not ashamed to admit it. Like Doug says, happy wife means happy life. And I tend to live by that. But my wife's the incident commander over that scene. And so somebody needs to make contact with her, and she will make it known that she's the incident commander. Show up at a nursing facility. Okay, who's the nurse? We're at a hospital. Who's the nurse? Who's the nurse in charge of this patient? I know what you're going to say. It's not my patient. I just started my shift. Those are the responses you're going to get. But still, you need to establish some form of command with that facility. Same thing with first responders, being fire departments. Who is that officer in charge? And we need to make contact with them. Police department. We're not always going to have a sergeant there, not always going to have a lieutenant or a captain that's on scene, but who is that officer that has some sort of control and command responsibility on scene? That's the person you need to make contact with. So the 5 pillars of command kind of came out of the LA County Fire Department multiple years ago. It's an incident command course that they've created that's kind of been adopted nationally in the ICS world. But the 5 pillars of command are basically, they're based on situational awareness, knowing what's going on, right? You get on scene, okay, what's our size up? This is what we got. Objectives. All right, our objectives on all the scenes that we make is patient care and transport. Resource management. Okay, how many patients do we have? How many units do we need to make this? Communications plan. All right, what radio channel are we talking on? Communications is extremely important in all of these incidents, because without, probably the most important pillar in command is communications. Without it, the rest goes out the window. And then the planning process, which is really for expanding and multi-hour incidents. But like we talked about, your situational awareness, you get on scene, what's going on, provide a size up. All right, so we got a 5-car MVC. All right, now we need to start counting bodies. What do we have? All right, triage made simple for you. Start triage is utilized in our system. That's what's taught. That's what's taught by protocols. That's what's taught throughout the system with all the other first response agencies. It's all based on respirations, perfusion, and motor. Green people that can walk out of a scene, they're going to walk. Those are your walking wounded. Those are the people that are injured, that have minor injuries. They're going to extricate themselves. They're going to relocate themselves any way that they can. The yellow ones, those are the minor ones. They still have a pulse intact. They can still follow commands, but for one reason or another, they can't ambulate. Either their back's hurt from the MVC that they're in, or maybe they've got some sort of lower extremity fracture that is not impacting perfusion or anything else. Those are the yellow patients. Red patients are the priorities on this. Those are the critical ones. Those are the ones that can't follow commands and or lack a radial pulse. There's been a recent study that came out, talking about triage and talking about different things. And one thing that the study came out with was the largest thing that impacts survivability is really GCS. Somebody's coma score, Glasgow coma score, if they can follow commands and if they've got a radial pulse. So that's really important, but that's triage made simple. You don't have to be a rocket scientist to figure this stuff out. Green ones are going to walk away or can walk. The yellow ones have everything intact but just can't walk. And the red ones are the critical ones that we need to start developing a plan in a hurry. And then once we've identified all these, we know how many patients we have, we know what their categories are. It's really, really important to provide some sort of scene size up. I'm not going to go into inertia, but it's really easy to move when somebody's already moving. There's not a whole lot of radio traffic on our system. We rely on a mobile device for, pinging us on our post moves and everything else. So you don't always know what you're getting into. But one thing that scene size up really helps when you verbalize that over the radio is that closest unit that's going to respond to you. They're already putting their food away, their book away, their mobile device away. They're getting their seatbelts on. They're getting ready to go. There's not going to be any kind of shoot delays. No signal 3 delays on this. All right, let's get rocking and rolling. We're getting called in on the big one. But let's communications know what's going on. There's a lot of things going on in the comm center, and them having visibility if you're working a major scene is really going to help with the resource management aspect. When you start working these major scenes, they're going to assign somebody on a multi-unit response or whenever you request it to a specific radio channel, so you're not walked over or ran over on the radio. It also lets a supervisor know what's going on. There's a lot of questions that get asked by supervisors. It gives them the ability to start communicating up that chain of command. Lets leadership know what's going on major incidents. So size ups are very, very, very important. And they're also not that difficult. All you got to do is just keep it simple, keep it accurate, and keep it timely. Midstar 48 on scene with 3 green and 2 reds. We're going to need 2 additional units, party 2, and a supervisor. Bang, you're done. All right, that's your scene size up. So you've taken care of your situational awareness portion of getting your size up. You're communicating. You've got a radio on your hip. You're using it, and you're actively engaging in resource management by requesting other things. So it's really not that difficult on these major incidents, being able to manage them. But one thing we're going to get into as well. But you got to have a radio on your belt in order to do it. That other thing, that was in there, the objectives. Our objectives are really, really basic on these things. All right, what do we need to do? All right, we do what we do, 300 plus times a day, and that's move people. We transport people. We do this really, really well. We provide great patient care, and we get people where they need to be. Resource management, what do we need to accomplish our objectives, all right? So we know how many patients we have. How many patients are gonna go in an ambulance. At this point, you should know how many ambulances you're gonna need. So now you're actively engaged in the resource management function. You're getting the resources there that you need in order to manage the situation and get people moved. Then determining your needs. That size up and that situational awareness is really important on this. And the minute that you lose situational awareness, you start losing control of your scene. You know, it's your scene until you're relieved. So it's your scene to manage. And the minute that you get tunnel vision, you get locked into one patient, you lose control of what's going on around you. You know, I've been a supervisor in this system, and I know a lot of supervisors feel the same way, and that they show up on a large incident and they get a primary or a secondary that's on scene rocking it, that they get a radio, they're communicating, they're managing the scene. That supervisor is going to show up. What can I do to support you? What do you need help with? I'm not here to sprinkle magic fairy dust on your scene. What can I do to help you? All right. So you're rocking and rolling. Everything's great. You're doing a great job. You're managing resources. You're communicating. That's all that you need to do on these larger incidents. Do not forget about staging. Staging is extremely, extremely important. You call in 5 units to your scene. The last thing you want is your scene to look like that. All right. Don't bottleneck your scene. If you're calling 5 units in, you don't need a staging officer. Let them know where they need to go. You don't necessarily need them all in at the same time, especially if you're kind of in a compacted area like a church parking lot. You know, I know it's a grainy picture and hard to see, but this was the parking lot at Wedgwood Baptist Church multiple years ago during the active shooter that they had there. All right. So the last thing that you want to do is create a log jam on your scene. Is ingress and egress important? Oh yeah. You know, some of these locations are a little complex, and you got to walk people in. You got to walk people out. But your ingress and egress into your scene on these multi-unit responses are extremely important. You know, not everybody has the same view as you while you're on scene, so you need to communicate that. That's why communications is so important, and that's why it's probably the most important pillar in the whole 5 pillars of command. And communications plan, it's not very complex. You've got a radio on your hip, use it. Who are you talking to? Comm center, what units are coming, what channel you're on. You know, a lot of these, you know, multi-unit responses, there's a lot of radio traffic because you're going to be telling them if they need to stage. You're going to be giving them instructions on ingress or egress. You're going to be giving them instructions on which patients there's. Ask for another channel. You know, don't let, you know, standard, normal, everyday radio traffic walk over your incident. Ask for another radio channel. You will get it. You will get a dedicated, you know, dispatcher on that radio channel. So you don't want anything interrupted. You want all your communications to be clear, precise, accurate. You want people to know what they're getting themselves into. All right, so bonus thing. So keys to de-escalating a scene. You know, there's several options to choose from. You know, when people start getting angry and upset while they're on scene, you can either A, just, you know, actively listen, make eye contact with them, you know, be empathetic or be sympathetic with them, and de-escalate it, or you could start yelling back, right? So you get a couple choices here. You can either actively listen, be engaged, listen to what's going on, be sympathetic with them, or you could start yelling back. Their voice raises, your voice raises. This is how we're going to do things. Well, if that's the case, if that's the decision and the road that you're going to go on, be prepared to do that, because that's when things are going to get out of hand. All right, that's when you need to start developing an exit plan off that scene, out of that house, out of that apartment complex, out of that residence or wherever you're at. Be respectful. Just be nice to people. Doesn't matter how loud their voice is getting, how high their voice is raising. You do not have to compete with them. You're there to help them. You're not there to judge them. You're there to take care of them. Another key to managing those dangerous scenes is that radio. You know, you're issued in that basket. I know a lot of people don't take notice of it, but there's 2 radios inside that basket that you get from logistics every morning. The expectations are that you have that on your hip at all times. You know, that radio is your lifeline. When you start getting into trouble, that mobile device isn't necessarily going to help you. That radio is going to help you. That radio is going to let people know that you're in trouble, let people know that you need equipment, you need resources, you need whatever else it is that you need. You're going to have it. Radio is very, very important. Crime scene management, another bonus topic here, something that we hit on during NEOP and multiple times. I know Chad has multiple conversations, you know, with people about crime scene management. You know, when somebody commits a crime, it's law enforcement's job to investigate it, bring those people that are responsible for committing whatever crime it might have been, you know, into custody, get them tried, convicted, or whatever it is, right? Just remember, if you did not bring it on scene with you, do not touch it. Does not matter if you're a weapons expert. It's not your job to clear a gun on scene. Doesn't matter if you're a blacksmith. It's not your job to judge the sharpness of other people's knives or any other tools. If you did not bring it, do not touch it. Don't pick it up. All right. And then, you know, not only that, but don't forget about trash. If you brought it in, it's your trash, make sure you pick it up, but pick it up in a way that you're not disturbing the crime scene. So I've talked for 32 straight minutes. We've touched on all kinds of different things, you know, on situational awareness, on scene assessments, on scene size ups, and some different tools as you go about your day while out in the field or really any in life. But, you know, ultimately, by doing all this stuff, it's your job to go home, right? It's, you know, this goes on with taking care of your body, you know, and taking care of yourself. You know, Mike Shelton teaches in NEOP that we got from Fit Responder that, you know, our workforce, they're occupational athletes. You do a lot of things out there that require, you know, some pretty forceful movements, sudden movements, and you have to take care of yourself. It's our goal as an organization for you to go home in the same shape, in the same form you did as you showed up, in a safely manner, so you can be around your loved ones when you leave. So with that being said, I appreciate everybody's time. I'll be more than happy to answer any questions if anybody has any. We've got a pretty good audience. There's quite a few people there. Haven't seen a whole lot of people drop off. Any questions? Well, Ryan, as I said, this is going to get recorded. I'm going to load this onto our LMS platform today and get this over to Heath or Stone, so maybe they could put on Facebook, and maybe it'll give some people some tricks and some helpful hints along their way to develop their craft and do the right thing out there. Well, I appreciate everybody's time, and I hope everybody has a great day.